Hi, this will be a short presentation on how to complete the American Academy of Otolaryngology Head and Neck Surgery Microvascular Committee Review of Hypopharyngeal Reconstruction Study-Specific Data Sheets. As a quick reminder, no data can be accepted from your institution until the study coordinators have on file a copy of the Notice of Outcome of Regulatory Approval from your institution's IRB. Page 1 starts with the unique subject identifier for each patient being included on study. To create each patient's unique identifier, simply take the name of your institution and sequentially number each patient being included. It would be helpful to include this at the top of every page of the datasheet in case any of them come apart. Next are the study inclusion criteria. For each of the 6 inclusion criteria, an answer of yes must be included for a patient to meet study inclusion criteria. If yes is not answered for every question, then a patient should not be included on study. Page 2 begins with demographic information including gender and age. For a patient's age at the time of initial treatment with concurrent chemoradiation, please use the date calculation worksheet that is provided on the study website. Using the date calculation worksheet will ensure that all intervals are collected for each patient in the study in a uniform fashion. You can see a picture of the date calculation worksheet here. All that needs to be done are the appropriate dates are entered in the yellow cells as labeled on the left-hand side of the worksheet. On the right-hand side of the worksheet, all appropriate intervals will be calculated. As you can see, all intervals are relative to the date of surgery, and all intervals are in days postoperative. This allows for additional arithmetic to be done on each of the intervals to generate new intervals if needed. Returning to page 2 of the datasheet, please collect the details of each patient's concurrent chemoradiation regimen. In addition, please collect the indications for surgical intervention after concurrent chemoradiation. Each patient's preoperative height and weight should also be recorded. The preoperative weight should be as close to the date of surgery as possible and ideally within a couple weeks of surgery. There are 2 intervals to be collected using the date calculation worksheet and the pretreatment TSH and highest recorded TSH. Again, the pretreatment TSH should be as close to the date of surgery as possible and ideally within approximately 1 month of surgery. At the top of page 3, please record each patient's preoperative albumin and preoperative prealbumin if available from preoperative labs. Further, please collect whether or not each patient is smoking at the time of hypopharyngeal reconstruction. For each patient with a smoking history, please record the cumulative number of pack years smoked. Please record whether or not each patient has a history of alcohol use. Alcohol use is defined as greater than or equal to 3 drinks per day. Please record whether or not it is a past or present alcohol use, and remember that a current alcohol user will also have a past history of alcohol use as well. Finally, at the bottom of page 3, please record each patient's immunosuppression status at the time of hypopharyngeal reconstruction. At the top of page 4, please record the extent of each patient's surgical defect. In addition, please record whether or not each patient underwent cricopharyngeal myotomy. For each patient, please select the flap site and flap type used for hypopharyngeal reconstruction. If a patient did not have a flap for hypopharyngeal reconstruction, please select Not Performed. Alternatively, if a patient had a flap used for hypopharyngeal reconstruction, but the flap site or flap type are unknown, please collect Missing Data MD999. At the bottom of page 4, first, please collect whether or not the flap had a cutaneous portion. If no flap was used for hypopharyngeal reconstruction, please collect Not Applicable NA997. Next, please collect whether or not the cutaneous portion was inset into the hypopharynx, neck skin, or oropharynx. If the flap had a cutaneous portion, then only yes or no should be collected for these 3 questions. Not applicable should be collected for these 3 questions if the flap did not have a cutaneous portion. Missing Data MD999 should be collected if this information is not available from the medical record. Finally, please collect whether or not the flap was deepithelialized or contained muscle. If no flap was used for hypopharyngeal reconstruction, please collect Not Applicable NA997. At the top of page 5, please record whether or not salivary bypass and nasogastric feeding tubes were used. If a patient had to be readmitted to the hospital, please use the date calculation worksheet to determine the number of days post-operative that the patient was readmitted and discharged from the hospital. Next, on page 5, is the recording of whether or not the patient suffered from a number of post-operative complications. For each complication, first, please record its presence or absence using yes or no. Next, if the patient had a complication, please record whether or not it was treated operatively at the bedside without operative intervention, or there was no treatment. If a patient did not suffer from a complication, then the treatment for that complication would be none. If the treatment for a complication cannot be ascertained from the medical record, please select Missing Data, MD 999. Finally, at the bottom of page 5, please record whether or not each patient developed a pharyngocutaneous fistula. For each patient who developed a pharyngocutaneous fistula, please record the number of days post-operative on which it was first observed. At the top of page 6, please record all measures used in the management of any pharyngocutaneous fistula that developed. If there was no pharyngocutaneous fistula that developed for a patient, please record not applicable NA 997. For any patient who developed a pharyngocutaneous fistula, please record the interval in days postoperative to fistula closure. Please use the date calculation worksheet to do this. We will be able to determine the duration of the pharyngocutaneous fistula using the information provided, so long as the date calculation worksheet is used. After this, there are specific complication fields for flaps used in hypopharyngeal reconstruction. If a patient did not have a flap for hypopharyngeal reconstruction, please select not applicable for these fields. If a patient did have a flap for hypopharyngeal reconstruction but did not suffer from a specific complication, please record no or none for the treatment of that specific complication. At the bottom of page 6, the transition is made to considering donor site complications instead of flap complications. Please record whether or not the patient had a donor site complication, and at the top of page 7, please record the specifics of that complication. Please record all that apply, and if there is a donor site complication that is missing, please write it in. Please record the treatment for any and all donor site complications. Please use the date calculation worksheet to record the interval to first oral intake after hypopharyngeal reconstruction in days postoperative and interval to TEP in days postoperative. If no TEP was used, please write 997. For the 12-month nutritional mode question, please use all available information in the medical record to make your best assessment of the manner in which each patient maintained their nutritional status. Finally, at the bottom of page 7, please record whether or not each patient had a stricture 12 months or more postoperatively that required dilation. Please also record if each patient was using a laryngectomy tube 12 months or more postoperatively, had TEP speech 12 months or more postoperatively, and 12 months or more postoperatively was using an electrolarynx. The speech outcome fields continue at the top of page 8, where it should be recorded whether or not each patient was using esophageal speech or 12-month hands-free speech 12 months or more postoperatively. For the 12-month understandability of speech field, please use all information in the medical record to determine your best assessment of each patient's ability to communicate verbally. Please record each patient's postoperative height and weight 12 months or more from the completion of treatment. Please record each patient's disease status at their last follow-up visit, and record whether or not the patient died from complications of hypopharyngeal reconstruction. For pattern of recurrence after hypopharyngeal reconstruction, please independently code whether or not patients had a local recurrence, regional recurrence, or distant metastatic recurrence. Again, these fields are for after hypopharyngeal reconstruction, not recurrences after chemoradiation that led to surgery with hypopharyngeal reconstruction. Please use the date calculation worksheet to record the last two intervals on the data sheet, specifically the interval to last follow-up in days postoperative and the interval to death. Please check for the date of death using the Social Security Death Index website provided. Thank you. Please let us know if you have any questions.